name's Mary Walthall. I'm going to be doing a health assessment on Alyssa here. First, I'm going to gather all of my equipment that I'm going to need throughout the assessment. I'm going to do my hand hygiene, provide equipment, and I'm going to observe for her overall appearance and look for any deformities. She doesn't seem to have any deformities, and she looks clean, put together, like she is dressed appropriately for the weather, and she doesn't smell. I am going to be looking at her mobility and her gait, and her skin throughout the entire assessment. Her nutrition, how much do you usually eat in a day?
I typically eat 3 to 4 meals a day.
Okay.
And I finish them all.
Okay. All right. She looks well nourished and of a healthy weight. So I'm going to be looking at her head for symmetry. If you look right at her face, go ahead and smile for me and puff out your cheeks. Good, symmetrical. She's got good eye contact with me. She's talking appropriately, so her hearing is good. She's not asking me what or trying to figure out what I'm saying. She's alert and oriented. And I'm going to go ahead and palpate her scalp for any bumps or lesions. It appears to be symmetrical, and I don't feel any deformities. Her hair, it appears strong and healthy and clean, not brittle. So then I'm going to look at her eyes, and looking at the corneal reflex. Okay, so I'm going to be looking at her pupils and making sure that my light shines at the same spot in both of her pupils. Good. And then I'm going to be looking for constricting and dilating of her pupils. So just pick out a spot behind me on the wall. Good. And I'm looking at the same one, and then I'm looking at the opposite one. Good. And then I'm going to have you look at my finger, and then look at that wall, and back at my finger. Good. And the pupils constrict when she looks closer and dilate as she looks farther away. And then I'm going to go palpate for her jaw, her transmandibular joint, and make sure that there's no clicking, popping. Good. It's a fluid movement. And I'm going to feel for her arteries, temporal arteries. Good. And they're strong. I can feel them. All right. And I want to look at all of the different aspects of the eye, looking at the sclera, the pupils, the corneas, under the eyelids. They're nice and pink. They look good. And then I will look at her ears. And I'm first going to just feel them. They look symmetrical on either side. Do you have any pain with that? No. Did I break it? Got it?
Mm-hmm.
All right. So I'm going to look in the ears. I'm looking in the canal and down to the tympanic membrane, and I don't see any deformities or abnormalities with that. Same thing on the other side. Good. Alrighty. And then I'm going to move on to the nose. I'm going to have you look up for me. I'll look at inside the mucosa and the tubunates. Good. Do you have any problems smelling?
No.
No? Okay. Go ahead and open up your mouth for me. Sorry. Okay. And say ah. Good. Good. So I'm looking at teeth and mucosa, her tongue, grading the tonsils, which they were appropriate size, the uvula. Okay. Then I'm going to move on to the neck. Yeah, you can chew your gum. Can you go ahead and circle around for me, looking for strength? Do you have any pain with that? So her neck muscles seem to be strong enough. And then I'm going to feel your carotid on both sides. Good. Strong on both sides. And then I'm going to feel for her thyroid. I'm going to come around to the back so I can do that easier. Go ahead and look up for me. Just going to feel thyroid. And swallow for me. Good. And I don't really, I was feeling for the trachea. I don't really feel the thyroid. If that was enlarged, then it can be palpable. All right, and then I will look at her chest. I'm looking for symmetry with the shoulders and then the trunk. And grab my stethoscope. So I'm going to see that she has symmetric expansion by placing my hands down along the bottom of the rib cage. Take a deep breath in. Good. And it causes my hands to go apart symmetrically, which is what we want. Go ahead and turn around for me. And then I'll do the same thing on the back. Take a deep breath in. Okay, and while you're facing that way, I'm just going to go ahead and listen to the back of her lungs so that she doesn't have to turn around several times for me. All right, just take a deep breath in for me. I'm going to have you go ahead and say E for me, and I'm listening for if it comes through as an E or as an A sound. E. Okay. E. Good. So it comes through appropriately. Can you go ahead and turn the other way for me? All right. And then I'm going to listen to her lungs in the front. And then I'm going to go ahead and take my fingers and do the percussing. So just in between the rib cages. Good. Good. And I do the same thing on the back. All right. Next, I'm going to listen to the heart valves. On the right side, aortic, and then left side, pulmonic, tricuspid, and the mitral. And then at the mitral, you would listen for a full minute counting the apical pulse. you would go through and listen with the bell. Alright. I'm going to next go on to the abdomen. Would you go ahead and lay down for me? So first I'm going to be looking just for symmetry and like that it's flat, the contour and shape of it. Looking at the umbilicus and go ahead and listen to it before I palpate. Normal, active, and all four quadrants. And I'm going to do some light palpation. Sorry, my hands are cold. And then I'm going to do some deeper palpation. Good. And then I can go up and palpate the liver, which is just underneath the right rib cage. I can feel it there. Go ahead and take a deep breath in for me. Good. And it comes down and kind of like hits your hand a little bit. And on that side, I'm feeling for the spleen. Take a deep breath. And I don't feel it on that side, the spleen, that is. Alright. Then I'm going to move on to, if you want to sit up, I'll be your upper extremities. So if you could move your wrists around and your fingers, open them, close them, and your shoulders. Do you have any pain with that?
No.
No. I'm looking at overall skin tone the whole time, looking for capillary refill, less than 3 seconds, both sides. Good. And I'm going to feel her radial pulses. Good. Brachial. Good. Strong, equal, bilaterally. And then I'm going to move on to her legs. Can you roll your ankles for me and your toes? Good. All right. And I'll feel for your fetal pulses. Good. And your tibial pulses. Okay. And then I would feel for popliteal, which I can't really do through genes. So, that's okay. Do you want to go ahead and stand up for me? Can you squat down? Good. Good. And bring your knees up. Good. And then take your right heel and drag it down your left shin. Good. Other side. All right. And can you close your eyes? Good. And she doesn't seem to lose her balance when she does that, so that's good. Okay. You can go ahead and sit back down. I'm going to test your Babinski reflex on your feet. So by stroking upwards, her toes should curl down. Good. All right. And next I'm going to do her reflexes. So I'll start with the brachioradialis. So just completely relax your arm and your wrist. Good. Good. And then I'll do your patella. Okay. And to do the tibial, I'll have her go ahead and lay down. Oops. Sorry. You're fine. And just go ahead and completely relax for me. Good. There we go. All right. Thank you. And can you take your right finger and put it on your nose and then your left. Okay, and do that quickly for me a few times. Good. So she's coordinated in her movements.